Thank you very much. Mr. Chairman, thank you for bringing this bill. Subcommittee members, thank you for taking this up. My name is Corey Feist. I'm the president and co-founder of the Dr. Lorna Breen Heroes Foundation. I'm the former CEO of the UVA Physicians Group, representing all 1,000 doctors and nurse practitioners at the University of Virginia. I'm also the proud husband of Jennifer Breen Feist, I should say, and dad to this wonderful daughter, Charlotte Feist, who is skipping school today to learn about the legislative process.
Time well spent.
Yeah, thank you. Jennifer and I co-founded the Dr. Lorna Breen Heroes Foundation after her sister, Dr. Lorna Breen. Unfortunately, thousands of healthcare professionals who take such incredible care of us, particularly during this pandemic, cannot access mental health support, and it's critical that that changes. On behalf of those thousands of healthcare professionals, I'm here to encourage you to immediately take action on HB 1573. Let me start very briefly, because I've been told I have to be very brief here by Scott, to tell you about Dr. Breen, my sister-in-law. This picture here that Charlotte's holding was taken on March 10th, 2020. Dr. Breen was a physician born in Charlottesville, Virginia. She graduated from the Medical College of Virginia. And at age 49, she was living her career dream of being a physician in New York City, where she served as the medical director of the New York Presbyterian Allen Hospital. She left our family vacation to take care of patients at the height of the pandemic in New York. In the 3 weeks that followed, she treated COVID patients, contracted COVID herself, and returned to an overwhelming, relentless number of incredibly sick patients. After 12-hour shifts, she and her coworkers would stay because of the influx of sick patients that never slowed. Yet she kept going back every day until she literally could no longer stand. Despite these overwhelming challenges, she pushed on and tried to push through. She shared to us that she was concerned that her inability to keep up would be viewed as a sign of weakness and impact her career. On April 9th, only 8 days after returning to the workforce, Lorna reached her breaking point. She could not get out of her chair. She was nearly catatonic and needed help. She answered the call for her city, for her country, but when she needed to make a call to support her own mental health and well-being, she was concerned that doing so would create ostracism in the workplace, impact her career, and her medical license. She died by suicide April 26, 2020, just 47 days after we took this picture with her. Many physicians, nurse practitioners, and other licensed healthcare professionals continue to suffer in silence with the mental health challenges due to both cultural and regulatory hurdles. In fact, the American Hospital Association just published a study identifying this issue, the issue you're talking about today, as the #1 driver of suicide of the healthcare workforce. Lorna kept telling us she was going to lose her license, lose her job, all because she required psychiatric care one time, once. We promised her she was wrong, but what we learned after she died was that in 31 states, including the Commonwealth of Virginia, she was right. Our foundation recently performed an independent audit of physician licensing applications from across the country and found that only 19 states in the country currently comply with the Americans with Disabilities Act and limit their questions, if any, to current impairment. Unfortunately, Virginia is not one of those 19. So we're here today to ask you to make it its 20th. In conjunction with this effort, together with the Medical Society of Virginia, the Virginia Hospital Association, and the Virginia Nursing Association, we've launched a campaign across Virginia called All In Caring for Virginia's Caregivers, with the goal of making Virginia the best place to provide patient care in the country. As part of this work, we announced an all-in challenge where we've challenged all the hospitals to follow this exact model that we're here today to advocate for and change these questions that appear in hospital credentialing applications. When you combine this effort we're here on today with the previously passed safe haven legislation that was supported by the MSV and many others, we will actually create in the Commonwealth a model for the rest of the country. There's a lot to do to support the healthcare workforce, and this is one incredibly impactful thing that you can do today. I want to thank you very much for taking this up. Thank you for your leadership, and I'm available for any questions as well.